Hey, you're listening to Rising into Mindful Motherhood. I'm your host, Dr. Katie Wood. I'm a barefoot mama bear, pharmacist, integrative fertility health coach, and lover of all things nature and animals. I'm on a mission to have intentional conversations about the good, the bad, and the ugly when it comes to fertility, pregnancy, postpartum, and beyond. My mindful guest and I will be talking about struggles, wins, natural wellness, and how we grow and transform as we enter motherhood. My background in healthcare has shown me how broken our medical system is. My own struggles to become pregnant has shown the lack of support for mamas to be, the lack of guidance for women to have a nourishing and vibrant pregnancy, the isolation, mom guilt, and all the things we hold after bringing baby earthside. I want this platform to be a place where women can feel connected, safe, and supported to share and hear their stories. A place to use our voice to discuss and advocate about what we need and deserve as mothers. So let's dive in, shall we? Hello and welcome to Rising into Mindful Motherhood. I am super excited for our conversation today. I have my dear friend here and I'll be chatting with Dr. Trish Francetich. She is an RTT practitioner, hypnotherapist, and pharmacist. She comes with over 30 years of experience in the health and wellness industry and is the CEO of Rise and Thrive Wellness, where she combines her expertise in holistic wellness and subconscious reprogramming with her love of inspiring and educating others. And today she will be sharing with us how Rapid Transformational Therapy, or RTT, can help women conceive and achieve successful pregnancies and pain-free births. RTT has also helped to increase the success rate of IVF. So I am super excited to bring you this conversation today. Welcome, Trish.
Thanks, Katie. Thanks, Dr. Katie. I am so excited to be here and to talk about RTT.
Yes, it is a relatively new topic to me. So I'm really excited that we're kind of taking your expertise and combining it with my expertise in like the field of women that I help. So I would love to hear a little bit about your background and, what has been going on for you in the last 30 years. How did you end up where you are today?
Wow. Yeah. So I feel like I've kind of gone full circle because I started out, I got married when I was 21. And so I didn't really want to go to college right away. And so I got into more like the health promotion side. I was actually a fitness instructor, and really started looking into nutrition and things like that. And then I decided to go to college, and I did that part-time. And so I did the non-traditional route. And then I was 28 when I got into pharmacy school. By that time, I had figured out that I wanted to do something, with myself. I wanted to go to college. And so I did, and I graduated. So I put off myself. So I was married from 21 to I got out of pharmacy school at 31. So we kind of put off getting pregnant. And then when I graduated from pharmacy school, he and I ended up divorcing. So I never, we never really got to that point where we were trying to conceive. And then I met my husband, Rob. I started working as a pharmacist. I met my current husband, Rob, a few years later, and he and I have been married for about 16 years now. But now I burned out from pharmacy, and I had to decide, what is it that, I want to do? What do I want to do for the rest of my life? And I kind of was getting stuck in that, becoming an entrepreneur. And I didn't know really how to get out of my own way. I didn't know what I needed to do. I just knew that having that identity as a pharmacist for so long, for 20 years, really, gosh, it was tough. It was tough, making that transition into entrepreneurship and even figuring out, getting clear on what it was I wanted to do. So I actually went to a rapid transformational therapist to help me. And oh my gosh, it was a game changer for me. And it really revealed a lot of things that I didn't know from my past that was holding me back, and imposter syndrome and all these other things that were getting in my way. And that's a real thing, by the way, imposter syndrome. So gosh, I wanted to become a rapid transformational therapist myself. I was like, I want to share this with the world. So I started that journey back in, gosh, when did I start that? 2021.
Mm-hmm.
Yeah. So November of 2021. It took me about 8 months to get my to graduate. It's a year-long program, and you can finish it up in 6 months. But so yeah, and then, I just want to work with everybody. I don't, so I don't really have a specialty. So RTT is powerful. It helps with just about anything. Infertility is one of those. And also confidence. And like I said, if you're an entrepreneur and you want to get started, it helps with confidence and anxiety and all kinds of things. It's easier to say what it doesn't help with. And it doesn't help if you're not hypnotizable, because it does involve hypnotherapy. If you are that kind of person where you have to be in control all the time, it's not really for you. And also if you suffer from seizures or anything like that, it's not the best type of therapy. It's not the best to even go under hypnosis if that's you.
Mm-hmm.
Yeah.
Love it. So many things that I want to draw from that. One, definitely being, I can completely relate to the pharmacist identity, like dilemma, because I went through the same thing, and I was in pharmacy for a shorter time than you. And I mean, I dealt with that too. It's kind of just like, it feels like such a boxed in role, where we're just, these are the things we do and this is what we do best. So yeah, definitely coming from that space and exploring the entrepreneurial realm was definitely challenging. So I can completely understand where you're coming from there. And I love that RTT was so transformational for you, that now that is sparking your passion to share that with others. And that really, I feel, mirrors how I got to where I am, my fertility struggles, and like how I kind of transformed from that experience is why I'm doing what I'm doing today. And I think when you've gone through that, that's really when you can show up for others, because there's a lot of understanding and like empathy and compassion and just passion really driving you at the end of the day.
Definitely.
Yeah.
I love it.
Awesome. And we've known each other for almost going on a year now, sooner than later. And I have seen just how much you have grown in the past almost year. And I can only imagine that, the RTT was really the catalyst for that growth.
Definitely. It sure was. Yeah.
Can you share, I mean, without obviously sharing any client, confidential information, but do you have any stories of any clients that you've helped and kind of where they were and how it has helped them in any way?
Certainly. I've helped mostly people experiencing anxiety that just want to dial that down and maybe even get to the root cause of that. So maybe I should just back up a little bit and talk about what RTT is and what it does.
Perfect.
And then I'll be glad to give you a couple of examples. It's mostly been with healthcare professionals who are also in the entrepreneurial space.
Mm-hmm.
So rapid transformational therapy, as I said, it's this game-changing approach to therapy. It was created by Marissa Peer. She is a British therapist, and she created it over 30 years. It's an award-winning therapy, and it's called Rapid. I mean, it's a unique blend of hypnotherapy. I think I did mention that. Cognitive behavioral therapy, which is talk therapy, neurolinguistic programming, which is, we won't get into that, but anyway, and neuroscience, because this is science-based. And it helps people break through their limiting beliefs and their behaviors that's holding them back in various areas of their lives, including fertility. So during an RTT session, I will guide my client into a state of hypnosis and work to uncover and address any kind of underlying emotional and psychological issues that may be impacting, how they show up in the world, and with infertility, maybe impacting their ability to conceive even. And that's not even it. I mean, the power of the mind and positive thinking and inner dialogue and visualization and all those things I help my clients work with too. But the session itself is about 2 hours long, about an hour and a half to 2 hours. And it is a regression-based therapy. So we will go back to scenes from your childhood. And it's always important to note that you're never reliving those scenes. You're just viewing them like on a movie screen. And it's really powerful stuff. And it uncovers so much. It uncovers like whatever your issue is, it'll take you back to an event in time. And then, as to how this has created your life today, why you're having this issue that you're having today. In this case, maybe infertility. So I find that with some people, when they have infertility issues, a lot of times it could have been some of the things that could come up might be when they were in high school. Maybe they had this overbearing parent and they had a boyfriend, and the parent was like, if you get pregnant, and so that's always in the back of their mind, and that carries over. I mean, the mind is powerful, and it's just keeping you safe. So if that's something that you were constantly like trying to avoid, maybe you didn't even want a period. There's some people are like, I don't know, I don't have a period. I don't have a regular period. Well, maybe sometimes what comes up is, I didn't want to have a period when I was in high school. I was ashamed about it. It kept me from doing things that I wanted to do. And so that's always an issue too. So RTT is powerful. So that 2-hour session, we call it rapid because we compare that to talk therapy, which you could go years. And I'm not going to bash talk therapy. Talk therapy, there's a place for it. And a lot of times talk therapy is good if you want to get clear on, what's going on. But that only deals with like the top layer, right? It only deals with the conscious layer. And with RTT, it's rapid because we go there, we go to those scenes, we reframe then, and then we install new beliefs. And by installing those new beliefs, I'm going to give you a very personalized hypnosis audio, and it's what you want to believe instead. So in the case of infertility, I want to believe that I can get pregnant. I want to believe that I'm going to have this robust and healthy baby, and that it's going to go great. And whatever your issue is around not being able to get pregnant. We also, you can also work with the men too, if they're having issues with maybe producing viable sperm or whatever their issue is, so it's going to be really tailored towards the couple. And the male and the female can have a session, a session. So they listen to that hypnosis then that I create for them for 30 days. And so they listen to that. They listen to it morning and night, and they're rewiring new pathways. So they're pruning away those old pathways with that old way of thinking, and they're replacing it with what they want instead. So all the things from the session. So it's pretty powerful. So, I've actually worked a lot with anxiety, and, anxiety can be a reason, to obviously not, if you're having some issues with infertility or just getting pregnant. So those people that I've worked with anxiety, we uncovered like the reason why
Mhm.
they have the anxiety that they have. And we always go back, it always comes up with something in childhood. Maybe what it usually boils down to is just not feeling like they're good enough. And then when they get in certain situations, we figure out maybe why certain situations cause anxiety for them. And I've actually gotten people where they have been able to come off of their anxiety medication from an
Mhm.
RTT session. So that's a huge success story there. And sometimes it takes more than one session. Sometimes when you get in there, it's kind of like peeling back layers. And so that's what we do. And a lot of times we really can't determine that until we're in that session. But RTT typically works in 1 to 3 sessions.
That's
That would
amazing.
be up to 90 days, which is why I offer 30, 60, and 90-day packages. So,
Hmm.
you know, for those people that need it.
Hmm.
Yeah.
And just out of curiosity, so if someone came again, would you create a new audio based off of that session?
Yes, because so in the first session, usually it's one thing. Say they come to me and they want to do anxiety and something else comes up.
Hmm.
A lot of times what comes up, I always tell people the first thing you should always deal with is maybe the self-love component or the self-love, self-worth is always at the root of everything.
Hmm.
How you feel about yourself. But it's like peeling back the layer. So it might not necessarily be the first thing, the first session you need, but a lot of times after we take off that top layer for the anxiety, what it comes down to is not feeling worthy and not feeling enough. So we do a session on that.
Hmm.
And so we do a whole new session, and then we get a whole new transformational audio out of that session.
Wow, that's amazing. And in up to 3 sessions, someone could really feel totally different.
Yeah, and they can come to me more than 3 sessions for
Sure.
different things. But if say if they're not getting the relief maybe from the anxiety after the first session and something else comes up maybe in a coaching call,
Hmm.
then that might prompt another session, and it may or may not be self love, self-worth. It could be something else that comes up. Maybe they're having trouble with their inner dialogue, and maybe that's keeping them from truly relaxing. And so we want to work on that negative self-talk,
Hmm.
because until we get a grip on the negative self-talk, we can't create. I mean, because we're only creating what we're telling ourselves. And so a lot of times that's another reason people book a second consult with me. If
Hmm.
it's not, if it's not the self-worth, self-love, it's like, I got to change the way I'm thinking, and this is not working.
Hmm.
So it's interesting. It's just highly individual, just like any therapy. It's just highly personal, and it's really, yeah.
Amazing. Yeah, and I'm sure, some people have like a lot of walls built up
Mhm.
around some things. So I can definitely see how it's really unique to the individual. And like you had mentioned, some people have so many layers and just deeper underlying things that really, really have to be like uprooted.
Yes. And the ones that are just like one session, that are always successful in one session, are like smoking cessation, a lot of addicting behaviors, smoking cessation, confidence, performance, public speaking, things like that. Those are usually fears and phobias. Sometimes we can get out of, one session is all they need in 30 days. So those are some examples of some really, really short ones and successful ones that you can eliminate really quick.
Yeah. And going back to what you were saying, like if you grew up and your parents were just like drilling into you that like, don't get pregnant. Or, if you grew up feeling like your menstrual cycle was like dirty or disgusting or things like there's really just so many things. Maybe you grew up and you had to have, or while you were younger, even in your 20s, maybe you had an abortion, or maybe you've had a miscarriage, no matter what the age is, like all of those traumas can really sit in the body and take up a lot of space. And even, sexual abuse, illnesses, like even loss of a loved one too. Yeah. And I've seen a lot of things coming up in my clients and just my community in general, where there's just really still trying to process those. Because a lot of times, growing up, we weren't really allowed space to process those emotions and feelings. It was just repress, like put it in the corner of your mind. Don't even think about it. So yeah, I think that this is such a wonderful tool to have available to women who are struggling to get pregnant and are struggling with limiting beliefs, like not feeling enough, not feeling worthy. I know I went through that myself when I was struggling because I didn't always want kids per se growing up. So I thought in my head, like, well, this is what I get because I didn't always want to have kids, and maybe I'm just not meant to be a mom, or I'm not motherly, or I'm not going to be a good mom. So I think that this is so powerful, especially like if you have the ability to even lessen these traumas or these negative thoughts in 3 months. I mean, that's a game changer.
Yeah. Yeah, it is. It is. It is. And what's really important is, getting out of that, because we don't realize that all of the stress that this causes, I think, and I know that you probably work with that with your clients too, getting them out of that stress state. I mean, that's a big part of what I do. And just helping them interrupt that stress pattern and how to get out of that, because we can't create, and that includes creating a baby and a life if we're in that constant state of stress and constantly worried about the fact that you're not getting pregnant. And why is that? So that just adds layers onto it. So layers onto what has already happened in your life that might be just preventing the negative thoughts. And a lot of times you're not even, they're not even aware of it, which is the amazing thing. And a lot of times you can do some journaling and you can go back to, with the right prompts, you can go back to maybe some things that you experienced earlier that might be contributing to why you might not be getting pregnant. If it's what would be the diagnosis for that if you're not able to get pregnant and it's not for any other reason?
Unexplained infertility.
Yeah, unexplained infertility. Yes, I was just drawing a blank on that. Yeah, so if it's unexplained and just doing that, bringing, just having that awareness. So if you don't reach out to me, you can always do some deep inner work yourself, and then try to figure out maybe what you have to change, what thoughts you might have to work on to change. And it's going to take you longer, but just becoming aware of it is, I have my ABCs. So I talk about getting out of that pattern interrupt, being aware of what you're doing, what you're thinking, that inner dialogue, those negative thoughts, whenever they come up, like this, I don't know, this, listening to all the things that you're saying to yourself when thinking about why you're not getting pregnant when that comes up. And then being aware of it. You may have to journal on it, and then calming that, because that is a sympathetic nervous system response. We are triggering that. We are triggering that stress response. So then to get out of that, I always tell people to breathe. Just do some breathing exercises. So be aware of it. Breathe is the B. And that's belly breathing, and then that sighing, releasing, and then create or choose a new belief. So what do you want to believe instead? And then say that to yourself. Say that new belief. So say, this is something simple, but say, you know what, I'm exhausted. And you're telling yourself, I'm exhausted all the time. Then you want to be not exhausted, right? What's the opposite of that? Being calm, I'm trying to think what would be the opposite of being exhausted. Yeah. I'm energized. Yeah. What do you want to believe instead? It has to be something that the mind believes. So create and choose that new belief after you do the breathing, and then tell yourself that and sit with it, and then visualize and feel the emotion of that. Feel the emotion of what it would feel like to be energized. And that's the secret sauce for manifesting.
Yes.
And so if you can get into that mode, get into that emotion, and I always tell this to people too, if they're trying to get pregnant, visualize, feel that emotion of what it would feel like to be pregnant.
Exactly.
And feel it, see it, with as many senses as you can. Do that as many times a day as you can.
Yeah.
Yeah.
Absolutely. And I just created in my group program a visualization meditation, and that's exactly what I take them into, is really embodying what that feeling would be if it were right now, as if it were happening right now. And yeah, I love that you brought up, bringing in all of the senses. So like, what are you wearing? What are you smelling? Where are you? Like, what are you feeling in your body? Like, I remember when I got the faintest positive on like our first pregnancy test, and I was just like warm and fuzzy, but like, is this really happening? So really just embodying that. And yeah, the more you do that, the more you're putting out into the universe that like, yep, this is for me. This is what's happening. And that's beautiful. I love those ABCs.
Yeah. It works with anything, so you can apply that to any area of your life. I just like to, and I do it with the negative thinking. So if you can become aware of that inner dialogue, that's so important.
Yes.
And, and then you can maybe get to the point where you just, you realize it when they come up anytime. It takes practice. It's like with anything else. And this is what I say about the hypnosis that I provide from my sessions. Repetition is how we're going to create those new neural pathways to create what we want. Yeah.
So being committed to listening to those audios that you create.
Yeah. And I have my clients sign a contract. Sign your contract to yourself. You're going to listen to this every day. I say twice a day, morning and evening. And in the hypnosis audios are about 15 minutes. I don't, give you that 30-minute thing. We can do that in 10 to 15 minutes. So
I love that, because we all know that we're all too busy in our lives. So to have it short and sweet.
Yeah.
And so one thing that I was thinking about when you were explaining RTT and like how the sessions work, one of the things I have my clients do in my group program is timeline therapy.
Yes, I do that.
Yeah. So, and it just kind of reminded me of that, although like what you do is on a much deeper scale and level,
Yeah.
but just creating that awareness because, we just sometimes move through life without even like, and if you drive home and you're like, how did I even get here? Or I remember I would leave the pharmacy and I'd be like, oh my gosh, did I lock the gate? Like we're just such on autopilot that,
Mhm.
sometimes you just don't even know what's happening. So when you do the timeline therapy, especially when you go back before you were born. So a lot of things is like the transgenerational trauma.
Mhm.
So if your grandparents or ancestors went through war or famine, or maybe your grandmother had a lot of miscarriages, or maybe she struggled to get pregnant, like that can be passed down.
Yeah.
Um, I'm not sure if you're aware of this, but like the amazing thing is I think it's around 6 weeks gestation. If you're having a girl, that girl is already has all of her eggs. So like let's see. So like it's the grandmother
Mhm.
technically like carrying her child's eggs like while her daughter is in utero.
Yeah.
So, I mean, if you think about it that way, like anything that your grandmother went through,
Yeah.
especially while she was pregnant, um,
Yeah.
that all passes down.
Yeah.
So, one thing I like to point out to, my clients or anyone in my community is doing this work is so much more than just helping you get pregnant.
Yeah.
Like, it is making a ripple effect of really transgenerational like change. Like you
Mhm.
are
Mhm.
healing these past traumas that maybe were passed down to you from your ancestors. So it's really just so much more than
Yeah.
what we say it is on paper, like when you think about it.
That's powerful. I'd be interested in seeing how you do the timeline therapy and how it differs from what I do, because depending on what people come to me for, I mean, I do, I can do past life regression too. I've done that with a client, and it was pretty interesting. So, it's not really even something I ever thought about until somebody asked me about it. And I'm like, sure, we'll try that.
Hmm. Yeah.
But just knowing, yeah, I do know that the generation from, from our ancestors really does impact us. I believe in all of that
Hmm.
for
Yeah.
sure. Like that cell memory that
Mhm.
it's in our DNA. And so,
Yeah,
yeah, we take on all of that.
exactly. And even just going back in your own lifetime, like maybe you got really sick when you were younger, but you never really thought about it. I mean, those
Yeah.
are all really, really traumas sitting in your body. So it's a really easy practice that you can do. I mean,
Yeah.
ideally, you'll have family members that can help recall some of the things, but
Yeah.
yeah.
That's what's amazing. We could have a whole different podcast episode on things that have come up in the regression, what
Yeah.
seems come up. It hasn't happened to me, but it's happened to a lot of therapists that where they've come up and they don't see a scene. It's dark, and they're come to find out they're in utero.
Oh, I've never heard of that. Oh, okay. Wow.
They haven't been born yet,
Uh-huh.
but they have the memory. They have a memory of their parents fighting and their dads saying things or their moms saying things. And that's such a powerful reminder that when when you are pregnant, talk to your baby
Hmm.
as it's say all positive things, and how that baby picks up on our emotions and our everything.
Yeah.
It's,
Wow. Yeah.
it's powerful stuff.
Yeah, I've never really heard that. That makes total sense.
Yeah. And,
Wow.
kids are like sponges, by the
Yeah.
until like 8 years old. I know you know this because you got to watch what you say around your kids because kids, they don't have that logic like we do. They're all emotion. So everything, they just pick up every little thing that we say and we do. And they're so observant and
Mm.
internalize everything. And this is how we have all these traumas, from when we were little. We don't even realize half the time, like how our beliefs were formed. It was always something from that time. And so that's why you really have to be careful around little ones.
That just brought a thought to my mind. Birth trauma. You
Yes.
know,
Yeah.
that can really be some of the first trauma that a child has. So, I mean, RTT for the mother and then potentially for the child, obviously, as they're older,
Yeah.
because that is definitely something that can stay with you and you may have like no idea.
Yeah.
I had a woman that I interviewed earlier in the podcast, and she had gone through some trauma and her son did too. And we were talking about that. So RTT, helping with that as well.
Yeah. Yeah. Sure.
Wow.
It's amazing.
Yeah. And just so versatile. It can be applied to so many things.
Yeah. And just one thing that I love to always say about RTT, and I love to always say about the mind is, and Marissa Peer says this. I was going to mention a book by Marissa Peer too. It's a pregnancy book, and we'll share that link on Amazon. But it's going to talk about everything I'm talking about and how to basically just have a I'm trying to think of what it's called here. Let's see. Let me get over here.
Yeah, I would love to.
Yeah, it's called Trying to Get Pregnant and Succeeding by Marissa Peer. It's actually published in 2012, but I can assure you it was ahead of its time.
Oh, I'm sure.
It still is probably.
I'm sure.
But yeah, she'll talk about RTT and how, and it's got a lot of that positive thinking in there. But one thing that Marissa Peer says all the time is when your mind says yes, your body says yes. So by saying yes in our minds, which requires that deep inner work that we're talking about, then your body's going to be on board.
Mm-hmm.
And with that pregnancy and everything.
Yeah.
Yeah.
And that made me think of, I know we briefly touched on before recording about hypnobirthing.
Yes. Yeah. Yes.
So I'm just thinking like if in your mind, you have maybe certain thoughts of how or ideas of how you would like to see your birth going, then the hypnobirthing, I know that that's something that you're relatively new to, but is there anything you could share about that?
So I know that it's really popular now, especially for women who want to do the natural, maybe the natural childbirth. And I got to say, it's not my area of expertise, even childbirth in general, like what even options are out there for women, but it's for women who want to make that childbirthing experience less anxiety, less painful, because hypnotherapy is powerful with alleviating pain.
Mm-hmm.
And so, so hypno birthing is just that. So usually in order to do that, I think there's a special training, special certification that goes along with that. You could certainly learn self-hypnosis if you're a woman and you're going to want to do, you're wanting to do like work with a midwife or more natural childbirth, then you could learn how to hypnotize yourself.
Mm-hmm.
People are always, people have misconceptions of hypnosis. Maybe I should have covered that. But so with hypnosis, you're aware, it's really kind of like a meditative state. In fact, you're more hyper aware, but you can learn self-hypnosis. And this is something I want to start teaching people how to hypnotize themselves. I just got a story to tell. I was in the doctor's office the other day. I had a potential skin cancer removed from my arm, and she did numb it with some lidocaine, but I hypnotized myself while I was sitting in the chair.
Mm-hmm.
And I was having a conversation with her the whole time. She didn't even know. And I told her, actually, I ended up telling her when we were done, I hypnotized myself. And she's like, what? So yeah, because I get a little bit squeamish on things like that. So I wanted to do that. It's powerful. The hypnobirthing, it's like, I don't think it's new. I think it's been around for a while.
Mm-hmm.
But I would definitely, always Google that, because there's someone that's got to be qualified to teach that.
Mm-hmm.
Somebody who is certified in that.
Yeah. I definitely heard about it when we were preparing for our birth, but I never did any course or reading on it. I had a pretty strong like connection with my breathing through like yoga and meditation. So that's
Yeah.
pretty much, for all I know, maybe I'm putting myself under hypnosis too, without even realizing it. I don't know. But yeah, I just really practiced my own kind of breathing. But I remember being in the pregnancy forums and a ton of women talking about it. So
Mm-hmm.
a lot of women know it and have gone down that road.
Yeah, it's definitely probably something you could even look into.
Yeah,
Yeah, for sure.
definitely. Oh my gosh.
And I have a good, if you're not wanting to go the RTT route, if anybody even is interested in learning hypnotherapy, I actually have a contact that I took as well. I took another course to become a hypnotherapist, and it's just a few days actually training, and it's online, just all online training. You can become a certified hypnotist, or if you're a professional, if you're a healthcare professional like us, you can become a certified hypnotherapist after just 8 days of training online.
Wow.
So if it's something, and then you could then do the hypnobirthing certification.
Very cool. That's awesome.
Yeah. Yeah.
What a beautiful conversation. I'm really, really loving learning about this and all of the benefits that it can have for someone. So I know you may have a freebie available for some people. Would you tell us about that?
I would. Yeah. So most of my freebies that I do are just a sample of a hypnosis.
Mm-hmm.
So when I say a sample, it's pretty much a 10 to 15 minutes. But it gives people an idea. Of course, it's not a personalized hypnosis, but it will get you the idea of what that's like, what my voice sounds like, because not everybody likes my voice, and that's completely fine. So you'll be able to see how that would be to work with me.
Mm-hmm.
So I have several hypnosis. I can actually create one specifically for this, but the one I have now is just a relaxation one. It's just a general relaxing one with the golden light, but it's a hypnosis instead of a meditation.
Beautiful. And I will put that link in the show notes when the show is released. So yeah, maybe if you wanted to do like a special fertility one or something like that.
Yeah,
beautiful.
I would be up for that challenge for sure.
So why don't you tell the audience where they could learn more about you and connect with you? Because I'm sure we have sparked a lot of interest on this show.
Sure. So I am on Facebook for people who are on Facebook at Dr. Trish Francetich. And I'm on Instagram. By the time this is out, I may actually have my Instagram back up and going. I'm having some issues with it right now, and I don't post a lot there, but that's another way to get in touch with me. And I'm at Dr. Trish Francetich there as well. And my website is drtrishfrancetich.com. It doesn't have the WW in front of it. You could probably just type it into Google but you'll have a link. Hopefully
Mhm.
I'll get you that link. Yeah. But so, hopefully even by that time too, my website will be up to date. I'll have some more offerings. Right now, I just have the 30, 60, 90 offering. And I have another one that does not involve regression therapy. It's hypnosis and coaching over the course of 3 months. And that includes 5 sessions of hypnotherapy.
Mm-hmm. Beautiful. And you're quite active on LinkedIn too.
LinkedIn, yes. So LinkedIn's my jam. That's where you can really find me, as LinkedIn. And I'm at Dr. Trish Francetich on LinkedIn as well.
Beautiful. Do
Mhm.
you have any final words of inspiration or anything that you want to leave with the audience?
Just, you're powerful. Everything that the words you say to yourself, the pictures you have in your mind, they're important. They are what's creating your reality. So definitely get into that. Practice those ABCs that I mentioned. It's really powerful. It can really turn your life around. It can turn, a negative situation definitely into a positive. I totally believe in it because it's changed my life. So you are powerful. You can do anything that you really set your mind to.
Mm-hmm. Yes. I like to say you hold the power.
Yes, you do.
Absolutely. I love it. Thank you so much for sharing your passion and your gifts with us today, Trish.
Thank you, Katie. I thank you so much for having me. It's been a pleasure.
It has, yes. Thank you so much for tuning in to the Rising into Mindful Motherhood podcast. If this episode resonated with you or gave you an aha moment, stop what you're doing right now and write a review. This simple act of kindness helps me get this podcast out to connect with as many women as I possibly can. I also have a special offer. If you send me a screenshot of your review, I will take $250 off one of my premium coaching containers. Let me know what resonated with you the most and why. So connect with me in my free Facebook community or tag me on Instagram. You'll find both listed below. Thanks again from the bottom of my heart for tuning in to this episode, and I'll see you next time.